The receptionist in this system is part of the enablement of people with dementia and the empowerment.
So you've got to nurture them a bit and help them out.
The receptionist might give them a call, they might try and use their name or introduce themselves to that person who's maybe a bit anxious about being at a GP, but then is welcomed.
People with dementia have poor short-term memories. Sometimes the information just doesn't go in, and sometimes it gets quickly forgotten. So write down key information for them and give them reminders as well.
They'll forget their appointments. So we've got sort of a strategy where we can give them a paper appointment card to put on the fridge, and then they'll get a reminder the day before.
They might give them an extra phone call. We've got several patients that we know not only do they need a reminder the day before, they need a reminder on the day.
Or it might even be in terms of wound care, or we're instructing them that they can't take a dressing off for a certain amount of time. So it's writing it down really clearly for them to understand and encouraging them that pop it on the fridge or maybe on a mirror in the bathroom.
People with dementia can find it harder to understand information, so break it down into smaller steps, give them time to process and ask questions, and check that they really understand.
Scripts. Classic example of older people can't use it on their phone, or if they do use it on their phone, don't realise that they've got to go back to that same pharmacy again to get the repeat script. Can't understand that there's more than one medication on the script, because if they want 4, they think they should physically get 4 pieces of paper for it. There's just that little edge that you've got to help them understand.
The receptionists, if we know someone has a cognitive impairment, they're going to make extra allowances for them.
People with dementia have trouble with their attention. They find it hard to multitask, so get them to do just one thing at a time.
You have to be very gentle with them, probably prompt them more than once, which we find you have to do.
Assisting them getting a taxi if they need to get a taxi to get home. So helping with all of that is often really good.
So ultimately we can get them in the door at the right time, and the doctor or the nurse can do the rest.